And there's one here. So we have Wendy here today. Wendy, what are some of your spots you want to work on today?
I would like to work on my back, shoulders, possibly maybe my wrist, my left wrist.
Okay.
Lower back.
Lower back. What's been going on with the wrist?
Just sharp pain. Unable to bend my wrist backwards, like back like this, and just a light twitching pains at night and even during the day. So I have to keep a brace in order to keep it in position.
Okay. And so it's bringing it up this way.
Right.
Okay. It seems really tender today. So I might use a little bit of the gentle adjusting instrument on it. And we'll see what we're going to do with that. But don't worry, we're not going to do anything that's going to upset you with that, okay? As far as the lower back goes, does that hurt all the time, or is it hurt just like bending down or leaning back at your desk at work, things like that?
Yes, especially sitting down. I experience a lot of lower back pain on the right-hand side, but it's not every day.
Okay.
So it's all depending on my movements, I guess walking a lot, things like that.
And then neck, shoulder?
Shoulder, left shoulder pain. I get a lot of left shoulder pain, especially towards my neck and down to my back.
Okay. And does it ever go down the shoulder, down the arm?
Down my arms, yes.
When you sleep, or just at any time?
At any time. And sometimes even down my legs. Like this whole side, this one side of my
left
body,
side.
left side.
And how long has the pain down the arm been noticeable?
This been noticeable for a couple of years now.
Okay.
Yeah.
So I'm going to have you start face down. Do you have shorts under there?
Yes, I do.
Good. So that's awesome. If not, we give people shorts. So if you ever need shorts, you'll just ask for them. We'll give them to you.
Okay.
And so whenever a woman is wearing a skirt or a dress, we keep shorts here and they can put them on. So go ahead and lie face down with your nose right in there. You can always rip this a little bit if you need to breathe better. We want you to be able to have a free spot for your inhalation, exhalation. Oh, that helps. Thanks for moving your hair. I'm going to move your legs to the center of the table. And the first thing I want to do is just see you lift one leg. So you're going to lift this leg, but lift from the thigh. So lift the whole leg up and put it down. And do you feel any tension in the back when you do that?
No.
Try it again. Good. Switch legs. Anything with that leg? Does it increase tension?
I noticed I'm able to lift this left leg further up.
Yeah, I could see that. So let's try that. So this one came up pretty high. Do the right one now. It's harder to lift,
Yes,
right?
it
It even bounced at the top.
Right.
Did you see that? Okay, so let's do something there first. I'm just curious. Oh, you know what we should also try? Bending the knees up. If I bring them all the way to the top like this, does that increase any pressure in here?
A little pressure in the lower right side.
Right. Okay, I'm just curious. Something we can come back and recheck. And I just want to see if we can change the height of the leg. So the left leg was the one that came up really strong, and the right one was a little sluggish. And I'm going to adjust into the sacrum. I'm going to come to the top of the ilium. I'm going to do a little bit of L5. And I feel a lot here at L4. Do you feel this one?
Yes.
Good. One more. Good. Now try to lift the right leg.
Oh wow.
What happened?
It seems like it's looser. I'm able to bring it up a little further, higher.
Yeah. And you also have more control. Did you notice? Because before when you brought it up here, I'll help you. You brought it up, it bounced at the top and then came down and you re-caught it. This time you're able to bring it up and you have control. So that's just a couple of little taps. So a lot of people think chiropractic always has to hurt or it looks so brutal. Yeah, some of it does look brutal. The fun thing is it usually doesn't hurt as much as people think it might. But there's also very subtle ways to work with chiropractic and alignment and improving the body and taking away any nerve interference in gentle ways. So there's a lot of cool stuff out there. Lift the right leg one more time. Nice, right?
Yes.
A lot better or a little better?
A little better.
Yeah, good. So drop the legs down. And I just want to do a little more alignment stuff before we move up. So I'm going to put these alignment shoes on. And if you watch any of the other videos I've posted, you'll see I put them on people. So when you go home, you can look at that. because you can't see when you're laying down, right? But basically they have lines on them and allow me to check. So right now her legs are even and your feet match up perfectly. As I bring it up though, I do get a little bit of a pulling and I'm curious if I'm not done with L4. So I want you to put this arm on the lower back. So you just put it up and drop it like this. And now look, it really goes short on the left. And it goes even shorter as I bring the arm up. So this L4 is not happy. And I'm gonna reach in and really try to dig it out. And I feel a crazy muscle knot there. I'm gonna put a lot of deep pressure there for a minute. Is that okay? Have you ever had a deep massage?
Yes, I've had.
Okay, so this is what I'm doing right now is just digging in deep, like a deep massage moment. I'm not gonna massage your whole body, just this one spot. And you should feel that pressure.
Yes, I do.
Does it feel kind of okay in a therapeutic way, or do you just killing you?
Painful killing me.
Okay, I'm just killing you. Okay, that's fair. I think that's truthful. But let's see if I can make a difference now. Okay, so I'm now gonna adjust back into it. Coming back to it, it's balanced in position 1. Let's put this hand back on the lower back, and it stays even. So I already took pressure off of that. When I bring the legs up, is it easier in there? Or is it still grabbing?
It feels loose, like doesn't feel painful.
Because remember when I first did it for you, you said you felt it here.
Yes.
So I'm going to bring this up. Do you feel it as much as you did in the beginning, or
No, I don't feel as much.
it feels a little better, right?
Yeah, much
Awesome.
better.
Good. So let's look up here. Turn your face to the right. And when you turn to the right, do you get any tension in the shoulder blades or high on the neck? Or not at all?
Not at all.
Not at all?
Mm.
Awesome.
No.
Turn your face this way. When you turn to the left, do you get any tension in your neck or your shoulder blade area?
My shoulder blade on the left side here.
Yeah, the famous left side, right?
Mm-hmm.
Back to center. Move your face straight down. Thank you. Now I'm going to adjust this spot, and I'm going to adjust this spot, and I'm going to adjust that spot. Now turn your face to the left and let me know what you're feeling. Did it change at all?
Yes, it did.
In what way?
It's not as tense. Before it's like feeling like there was a not like tension that was there.
Okay, good. Is it any tension still there, or is it pretty much gone?
It's pretty much gone.
Awesome. All right. Pull this left elbow against the side of the body, just this side only. I just want to see what that shoulder's doing, because that shoulder's been a problem. Look, that made your legs go short again. When I bring the legs up, it stays short. You can relax this elbow now. Your shoulder blade rotated medially. So to adjust it, we adjust it back from medial to lateral, but then we also have to take the humerus too. So we adjust the shoulder blade medial lateral. Do you feel how this is tender right here at the top of the shoulder?
Very.
Very tender. So I'm adjusting the humerus from inferior to superior. I'm going to move your arm up here, and you're going to have a crazy knot right here when I touch it. Watch this one. Do you feel that?
Oh, yes.
Okay, so I'm going to adjust that one. And then I'm going to adjust the wrist. And that's your bad wrist, right?
Yes, it is.
The left one. So squeeze that elbow into the side of the body again. Let it roll out. Just relax it now. Let me just see if that took the pressure off. It did. Let's flex your hand this way. So I'm just going to have you pull your hand up. So I'm having her do this with her hand. Hold that just for a second. And it made your leg go short a little bit. So relax. I'm going to adjust into the lunate bone. And now flex it up again. And the leg stayed even that time. Good. So now let's try, we're going to go next to ulna deviation, which is you're going to pull your pinky to your ulna side. I'll do it for you. And just hold it there. Hold that right there. Good. Let me go look at the feet. That made your feet go really short, almost like 3/4 of an inch. So you don't like that spot, do you?
No.
So I'm working on your wrist a little bit, but I'm doing it really gentle and very specific. So I'm going to come in and adjust across. We're going to go back to ulna deviation. Hold it there again, where we're deviating the pinky side of the hand and the legs stay balanced. So now we're going to go to radial deviation. So you're going to hold it this way if you can. Hold it there. So I'm tilting it, and that's what you're holding. That's okay. Now, I know you don't like Here, let's move it up here. You said bringing the hand back is tough, right?
Yes.
So bring it back as much as you can.
That's it.
Okay, just hold it there for 1 second.
Mm-hmm.
And then the feet go, it pulled short again. So you could relax. I'm going to adjust the carpals. I'm not going to adjust the middle because I just adjusted the lunate. So I'm going to come, not in the middle, but off center. I'm going to adjust the carpals from posterior to anterior. And I'm going to adjust the other side. I want to do a little bit more on the radial head. Now bring that hand back up.
I was able to do a little bit.
You can
further
get,
up,
you get a little more?
More, yes.
Good. Without pain, right?
Right. Mm-hmm.
So I'm just going to do a little more in there because now we're getting some. Now lift it again. How's it feeling?
The same. The second time, feel a little better. I'm able to bring it up.
Is it better than when we started?
Start. Yes.
Okay,
but
now
it's a little painful.
I'm going to come onto the top of the thumb, and I'm going to pull down here and create space, and try it again. That might be all we're going to do today because I know it's really sensitive. I want to overdo it. So relax your hand again. This time lift it one more time. I just want to get a check at the feet. Okay? It's balanced, so you can let go. Good. The last thing we're going to do is I'm going to have you lie on your back. Let me take these shoes back from you. And I'll take the paper away. And lie on your back. And then scoot up to the top of the table, please. And that's enough. Yeah, perfect. Here you might want to... Yeah, perfect. May I move the hair just out of the way a little bit? Mm-hmm. Thank you. Perfect. So do you feel that one here?
Yes.
Little tight spot?
Mm-hmm.
So I'm just going to do a little bit. You're going to hear a click.
Oh, yeah.
Was that okay?
Mm-hmm, it was.
Good. And there's one here.
Oh.
Do you see how the left side was a little more active?
More active, yes,
Yeah.
it was.
So I'm curious to see what you notice in that left arm.
Mm-hmm.
You do need a little work because I think it's been, your body's been holding a lot of stress.
Yes.
All the hours you work,
Yes.
you're in computers, you're in monitors, right?
Mm-hmm. I work with kids.
Work with kids, so you have,
a lot.
well, there's a lot.
Stress.
I'm going to have you move towards me. I want to do one last spot just to help your upper back.
Okay.
So move closer to my edge. And I'm going to reach up like this and put my hand in here. I'm going to lean on you. Is that okay?
That's okay.
Okay, thank you.
Oh.
Good.
Oh.
What do you think of those?
Oh. Yeah, I feel feels relaxed. Like I feel loose.
Loose, good.
Yes.
Because I think that's been tense for a while.
Yeah.
So scoot down towards your feet a little bit so I can create some room up here. So you can just slide straight down towards your feet. I'm going to give you a pillow.
Okay.
Lie on your side facing me. So you're going to turn this way. You're going to put both arms over here. And I'm going to double your arms up like this. So you're just going to hold your own arm. And you're going to pull this knee up. And this one goes straight. But do you see how far away you are? I want you to come to this edge. So just keep hopping over till you're close to this edge. Good. And I'm just going to start stretching through your lower back. One more. Good. And now come stand up over here. Yep. And see how you feel.
Oh. Oh, wow.
What do you think?
I just feel like I had tons of bricks rolled off my back. I feel loose. Just I had a body massage because I normally have.
Yeah.
This really feels good.
That's good. How's the wrist feel?
It feels a little better too.
Okay.
Yes, I'm able to go backward, not fully, but I'm able to do this without my fingers hurting because they were very painful. Just doing this,
Okay.
it was painful. But it's not painful this time.
The diagnosis that she got from her medical doctor was tenosynovitis, and that's a lot of inflammation. There's can also be fluid built up in there, and we just met today. She's not an ongoing patient of mine, so I didn't want to overdo it on the wrist, so I started out real small with very gentle alignment stuff with the activator. Down the line, if she comes back and wants to work with me a little bit, I might get in and and adjust it, which I do quite a bit of. But I just didn't want to do it on the first time. Plus, she has no experience with chiropractic. So I think we did a lot today, and it was safe. And you know, there's also that level of trust. She doesn't know me. She doesn't want to come in and me just, you know, scare the hell out of her. So we did enough that she had maybe 5%.
Yes.
Yeah, so that's okay. We move the graph, and then we can see where it goes from there.
Yeah.
And you know, as she starts to get more mobility in the wrist, we could always do more. All right. Thank you for coming in.
Thank you so
All
much.
right,
I appreciate it. Likewise.
All right.